Welcome to those of you who are just joining us. Just hang tight for a few minutes while we wait to let other people log on. Welcome to those of you who are just joining us. Please hang tight. We're going to give it a couple of minutes to give people a chance to get logged on before we get started. Welcome to those of you who have just joined us. We're going to give it another minute or so to give people a chance to log on, so just hang tight. All right, I think we're going to go ahead and get started. Hi, everybody. For those of you who I haven't met yet, my name is Hilary Godwin, and I'm Dean of the UW School of Public Health. Welcome to our bi-weekly webinar on COVID-19 and the UW and the school's response to the pandemic. Today, we're discussing what changes in public health policies and priorities we can expect at the federal level under our new administration and in Washington State in the current legislative session. Before we continue, I'd like to acknowledge that even though we are all calling in via Zoom, that we are all on Indigenous lands. Personally, I'm calling in from the land of the Suquamish people, and in Seattle, where many of the folks on this call live, we recognize the Coast Salish people of this land, the Suquamish, Tulalip, Duwamish, and Muckleshoot nations. We honor the people who are still here and on whose lands we are guests. These webinars, which we started early on in the pandemic, are designed to keep our community informed and connected as we work and study remotely. We welcome any alumni or members of the UW community who are joining us today. And while anyone's welcome to watch or take part, I just want to give my standard disclaimer, which is that if I provide guidance about what's going on or practices within the school, that if you're not primary in the school or if your employers were other than UW, for sure, to check with your supervisor to see whether the same thing holds true for you. Another reminder is that we use the Q&A function to post questions for myself or for the panelists. So please use that instead of using the chat box or the raised hand function. We will use the chat box to post resources. I would encourage you to keep it open, but the raised hand, there's just too many people for us to track that. So like I said, please open up the Q&A box and type your questions into there. Today, we are super excited to welcome Jeff Ketchel, who's the Executive Director of the Washington State Public Health Association and an affiliate faculty member in the School of Nursing and Health Studies at UW-Bothell. And we're also excited to welcome back Aaron Katz, who is Principal Lecturer Emeritus in the school's Department of Health Services. Aaron retired last year, which we were sad about, but we're really excited to have him here today. And he now serves as a member of the Skagit County Board of Health. So before, super appreciate both of you guys joining us. Before we jump into today's topic, I'd like to give just some quick updates about the state of the pandemic and what's going on here at UW. So as always, our hearts go out to those who have lost loved ones or whose loved ones are currently battling COVID-19. Worldwide, there have been more than 107 million confirmed cases of COVID-19, and global deaths total more than 2.3 million. In the United States, we've recorded nearly 27.2 million cases so far and almost 470,000 deaths. The number of US COVID deaths remains high. It rose sharply in November, but seems to be falling steadily at this point. So that's giving us some window of hope. In Washington State, the Department of Health is now reporting more than 300,000 confirmed cases of COVID-19, over 18,500 hospitalizations, and more than 4,500 deaths. The state continues to make progress with its COVID-19 vaccine distribution and administrative efforts. So as of February 6th, more than 940,000 doses of COVID-19 vaccine had been given in Washington State, which was nearly 79% of the total doses delivered to providers in the state, which is fantastic. Currently, Washington is averaging about 26,800 vaccine doses given per day. The governor and DOH have stated a goal of getting up to 45,000, but reaching that will be dependent upon our state getting higher amounts of vaccine allocated. Obviously, we're hoping for production to ramp up. Some of the biggest news around COVID-19 in the last couple of weeks has been the detection of new variants. Last month, there was evidence of the new UK variant B.1.1.7, which originated in the United Kingdom, was found in Washington State last month. And I wanted to highlight, and hopefully Ashley will put this in the chat box, that the Department of Global Health, in their collaboration with DOH, has just released a new in-depth report summarizing the published evidence on how both the UK variant and the South African variant differ in their transmission characteristics and how the vaccine efficacy varies for those variants. So please do check that out. It's a great summary. Somewhat disappointing news, but not unexpected. Yesterday, the Husky coronavirus testing program reported the first UK variant in a student on the UW Seattle campus. For confidentiality reasons, of course, we don't know who the student is, but we hear that the student is doing well and out of their isolation period. The small number of close contacts that person had have been notified. I think really for all of us, the big news of this is that it is just reconfirming the importance of us all engaging in our traditional public health measures to limit transmission. That's still what we're mainly depending upon. And obviously masks are an important component of that. New research released today from the CDC shows that wearing a more tightly fitted surgical mask or layering a cloth mask on top of a surgical mask can provide increased protection to both the wearer and to other people. So it's an important strategy. One thing Jeff Duchin said, which I liked, because it's something that I've heard people complain about, including myself and my husband, is if your glasses are fogging up, that's a sign that your mask is not tight enough. So You're right, it's a problem that your glasses are fogging up, but the solution is not to take off the mask. As spring break approaches, just a reminder that we need to remain vigilant in our prevention efforts. We all need to continue wearing masks, washing our hands, practicing social distancing, staying at home if we're sick, and getting tested for COVID-19 if you have symptoms. So a quick reminder about spring quarter. Most UW courses, and I believe all courses in the School of Public Health, will remain online during spring quarter. Also, because I've heard from some angst from people, a reminder that there's official word from the university that employees who are teleworking can expect to be able to do so at least through the end of spring quarter. That's reassuring for many people. Some good news on the local policy front. This week, Governor Inslee signed legislation providing relief for businesses and workers impacted by the pandemic. The bill will increase minimum unemployment benefits for workers and provide significant tax relief for businesses over the next 5 years. This legislation is one of several bills lawmakers are quickly moving in order to help Washington residents and businesses hurt by the pandemic. And we also heard this week that Insurance Commissioner Mike Kreidler extended his emergency order on coverage for telehealth and diagnostic testing for both flu and COVID-19 through March 7th. And Ashley will, as she's been putting up the links for all these things in there, she will add those to it. So now it's time to turn to our two fantastic panelists. So as everyone knows, Joe Biden and Kamala Harris were sworn in as president and vice president of the United States on January 20th, and they've been super busy since then. And here in Washington, we're 31 days into the 2021 legislative session. So tell us what we should be expecting. I'll start with a question for Aaron, but I will also be monitoring the Q&A to see if we get some questions there. Aaron, first off, do you expect to see any big changes in federal policies that affect public health now that we have a Democrat, not only in the White House, but also Democratic control of both the House and the Senate?
Well, that's like the $64 bazillion question, but I'm optimistic. So I think there's three changes that I expect, and we're already seeing the early signs of it. First is just a change in the philosophy of the government's role in helping people and being able to live healthy, productive lives. And I think we're seeing the Biden administration already make strides in a number of areas around income, employment, housing, food security, and healthcare. And I think we're already seeing, and we'll see a more assertive role from the federal government in the response to COVID. So that's just going back to the day where the federal government sees that it has a responsibility to be an active player. Secondly, around global warming, and not just going back to it being a niche issue at the EPA, but it's impressive to me that Biden has made dealing with global warming and our responsibility to deal with that a whole government approach. And the third is just getting the U.S. back involved globally to be a collaborator, not just on health and public health, but I think a whole range of issues. And the last thing I'd say is, an exciting time for us who've been beating the drums around fundamental determinants of health, that COVID has shined a light on those determinants. And I think the federal government and Biden Harris administration has grabbed hold of that reality and is really seeing the need to address all of these different sectors as a way to improve people's health.
Thanks, Aaron. That was a great answer. Very comprehensive. Jeff, next question for you. And I just want to mention audience members. We'd love to get questions from you guys as well. So feel free to pop them in the Q&A box. So Jeff, what sort of conversations are we having about public health during this legislative session in Washington State? And are there any policies or bills that we should be particularly paying attention to in the coming weeks?
Sure. The two main conversations going on have to do with funding and governance, and I'll touch on both of those. And so for those who aren't familiar with our governmental public health system, public health is generally funded by 4 different arenas: local, state, federal, and then fees. Local public health jurisdictions don't even have the ability to tax. And over the past 20 years, the public health system in Washington, as the population has gone up and new diseases emerging have emerged, funding has continued to decrease, especially on a per capita basis. And so public health has not had a sustainable source of funding either for about 20 years. Back when Tim Eyman's first initiative, car cab initiative, passed in '99, the Initiative 695, which eliminated the vehicle excise tax, which was a sustainable source of funding for public health. And we can argue that maybe that's not the best source of funding for public health, but it's what we had. And ever since then, it's been very hand-to-mouth, very reactionary to the crisis of the moment, be it 9/11, H1N1, opioids, or getting hit because of the Great Recession. And so that up and down of money has really affected public health's ability to do its job. So about 10 years ago, a bunch of public health leaders came together and developed foundational public health services. And that's a term you may have heard others and myself reiterate. And what a foundational public health service is it's those services that are unique to government and should be provided to every Washingtonian. So this does not include very valuable and evidence-based programs like Nurse Family Partnership or WIC, but includes things like policy and communication, disease surveillance, disease investigation, things that everyone should have access to. And then we went about saying, well, are we delivering these services to a great enough degree? And if we're not, what is the funding gap? And the funding gap in Washington State was found to be $450 million a biennium. That's how much public health has been underinvested over the past 20 years. And so we've gone to the legislature on numerous occasions with this number and some big asks, and we've usually walked away with sort of pennies on the dollar responses. But not a single public health person has said, "I told you so." But here we are with the biggest public health crisis of our generation, if not greater. And the legislative response is, you were right. You need sustainable funding, you need predictable funding, you need adequate funding. And so we're seeing some big initiatives in that regard. And there's 2 big ones I want to mention here. One is an assessment of covered lives, meaning a tax on health insurance policies per person per month. And currently the bill's numbers are 5149 in the Senate and 1201 in the House. Would be $3.25 per month. Of course, this is very fluid at the moment. And this would generate $200 million per year, which is a substantial amount of money. And then another bill which has been introduced, 5371, which would be a statewide tax on sugar sweetened beverages. This would raise a substantial amount of money, but 60% of it would go to equity driven initiatives and projects, and 40% would go to public health. And so that bill hasn't had a hearing yet, but we're still taking a look at that. And on the other issue around governance, so public health and politics have always had these rubs, these tensions, these frictions, whether it's the anti-vax movement, or my background is environmental health, and so regulatory environments always have a little bit of a push and shove with the politics. But what we've seen over this past year has been an exceptional amount of tension there between public health leadership and elected officials. So much so we've seen a lot of public health leaders depart their positions one way or another. And so there are some bills looking to address that and perhaps reform the public health system. One is Bill 1110, which would look at how a board of health is made up. Right now, boards of health are entirely or predominantly elected officials. This would bring more health experts onto local boards of health. And then the other bill, which is a governor request, 1152 and 5173, is a substantial reorganization of the public health system. And it's receiving mixed reviews, and but it would not only reorganize possibly regionalizing local public health, possibly making the local health officer a state employee, how the Board of Health is made up, how funding is distributed. And so this is an ongoing conversation, and more to come on that one. But to see that the legislators respond to these two big issues so substantially has been very interesting to watch. And I could talk about these things for another 30 minutes, but I'll stop there.
No, that was a great summary. We got a question from one of our participants asking whether or not you rattle off those numbers, just like I know you deal with them every day, but could you maybe type some of the numbers into the chat function or direct people to a page maybe on the WSPHA website?
I'll put them in the chat for sure.
Okay, cool. And so that people know, we also will definitely put them in. We always do key takeaways for the webinar and also a recording of it. So those will be up on the website later. Yeah, Aaron, go ahead.
Could I, yeah, just comment on both of the topics that Jeff noted. One is, I think it's leadership is a critical thing in Olympia around public health, and it's important to note that while Jeff noted that Tim Eyman's first initiative was to repeal the motor vehicle excise tax, but in fact, the initiative was determined to be unconstitutional by the state Supreme Court, but the legislature enacted it anyhow. And I think the reason I bring that up is just that the accountability for the demise of public health funding in the state of Washington is largely in the legislature in Olympia. And I think it's the right place for this to be worked out again. And I'm glad to hear that the legislators are serious about it. The other thing I want to talk about is the governance issue. Now that I'm on a local board of health, and with a very big nod to my longtime colleague and mentor, Mary Selecki, that the issues here are around what will solve what problems. And it's not clear what the problems are. There's some concern that this is a knee-jerk reaction to the firing of a health officer in Spokane and a proposal to take apart the public health district in Pierce County, Tacoma, Pierce County. And I think, so there's got to be a lot of conversation that has to go on there, maybe beyond, maybe outside and beyond the pandemic.
Agree, and I also throw in Yakima as well, where the county commissioners there are attempting to seize greater power over control of the health district. And so we're definitely seeing a large trend there. And how do we want to create a balance? Some tension is always good, but you can't have it. You shouldn't have it swing one way too far or another.
So, what you guys were just talking about in terms of that struggle, I think, is probably had been brewing for a while, but largely influenced by the pandemic and the pandemic sort of shining light on how public health works and how we're organized. Are there other ways that you could sort of, as you reflect back over the last year, that you think are worth calling out in terms of how the pandemic has shaped the health policy agenda, either nationally or locally?
Well, Yeah, I mean, I think there's a number, we've touched on a couple of big areas. COVID has shined a very, very bright light on the inequities in American society in all realms, from housing to food to employment, you name it. And, there's a lot in healthcare policy and public health policy that I think, are matters of discussion now. There's discussion at the state level here about the role of point of service cost sharing in preventing especially lower income people and people in BIPOC communities from getting the care that they need. As I said before, the focus now on the fundamental determinants of health. It couldn't be clearer. And I think that's a good thing. And we're beginning to see initiatives in a variety of areas like employment actually mention the relationship to health. And the last, of course, is that the pandemic has highlighted the gross deficiencies in the U.S. healthcare system. Right when we need everybody to have ready access to every kind of service, diagnostic or treatment service, we've got tens of millions of people who face, barriers. They don't have insurance. They can't get insurance. They can't afford the care that they need under the insurance policies they have. So I think it's changed the conversation. You're beginning to see, like in the COVID relief bill, the Biden-Harris administration have proposed large increases in subsidies for people getting coverage on the exchanges. I think they need to go further for subsidies of cost sharing provisions as well as premiums. But yeah, I think COVID has really changed, altered the ground of health policy discussions.
Yeah, and I will also add, just like the pandemic has exacerbated the political issues, it's also exacerbated the siloedness of our system. So my wife is British, and I'm fascinated by the National Health Service, and I'm not saying we should transplant it here or not, though I might think that might be a good idea. But here you have public health broken up into local, state, federal, tribal arenas. Then you have healthcare system, and then you have the carriers. And it's a constant competition for resources and power and decision making, and those tensions and lines of communications have been tested greatly in this pandemic. And what we're seeing is if things were a little bit more unified, I think our response could have been robust. On a more population level, and I found this interesting, is public health is one part of the three-legged stool of public safety with fire and police. And of course, we were always the least visible. We don't have cool uniforms. We don't have cool red trucks to drive around in. And the one time in public health career, I wore a lab coat. I felt kind of goofy, but never before has the public been more aware of what public health is and the authority it has in their day-to-day life. And that has had a very mixed response from the populations we serve, whether it's appreciation that the public health system is there to monitor diseases, to respond, to help prevent the spread of it. But on the other side of it, the local health officer in each county has a tremendous amount of authority to close a business, require somebody to be isolated or quarantined, a mask mandate. You're a non-essential business, you're not allowed to operate. And suddenly the public saying, I didn't elect this health officer. What gives them the power to run my life to this degree? And that's been part of the tension. But here on a state policy front, people are realizing the value of public health. And there's this public push, and that's what we're seeing in Spokane, in Pierce County, and Yakima. We're seeing these grassroots organizations form in response to what has been happening, and saying we don't like how our public health system is being run, and we want to see more accountability. We want to see more engagement. We want to see better leadership, and we want to see health being better protected, especially for more marginalized populations. And I think that's a very good thing, that the public is so aware of what's going on and are taking action.
So we're starting to get some questions. One, just as a reminder, please put those in the Q&A box. But one was, so, has the last year made either one of you think that perhaps Washington should be working to create a better universal healthcare system for our state?
Well, over the last year, there was a work group, the Universal Healthcare Work Group, that was managed out of the State Healthcare Authority. I sat on that work group, and its job, it was created by a budget proviso a couple of years ago, and its job was to come up with a pathway to universal coverage. And of course, meeting and discussing in the midst of the COVID pandemic just highlighted, and I would say gave impetus to the push for this pathway. So there is a bill, I think it's Senate Bill 5399, that is moving. It's now a policy committee, and I think it's going to Ways and Means, that would create a commission that would essentially design and build a universal healthcare system. Right now, I think the target date is 2025, but there's some push to move that up to 2024, 2023. So yeah, I think the pandemic added fuel to that, to those discussions, just because it highlighted all the things that are wrong with our healthcare system.
Yeah, I'd say anything that helps bring the system together. I have conversations with legislators, and they use the term healthcare and public health interchangeably, and it's one of my pet peeves, because even though there's a lot of overlaps, we are very different operationally, and to find some better ways to connect better, I think would be a great thing.
So Jeff, here is like a question like the last one, like someone's offering you an opportunity to speak on one of your favorite topics on a platter. This one is from Jim Guadino, who wants to hear about how Washington State, or I would say WSPHA, is mobilizing its public health students and professionals to, I'm not sure if we're allowed to use the word advocate, but to educate them in the processes of the Washington legislature and contribute to educating legislators.
Well, thank you, Jim, and thank you, Hilary, for that great question. We are working rapidly towards March 4th, which is our Legislative Education Day. If you've participated in previous education days over the last years, they were wondrous events down Olympia with food and networking with your colleagues. This is going to be very different. It's going to be online. It's going to be virtual. It's going to be a lot easier for people to attend. I live here in Spokane, so I won't have to travel west of the mountains, but we will have a virtual day. It is free. Registration is open right now. The bulk of it will be in the morning, and I would encourage you to not only sign up for the event, but you'll end up getting on our mailing list, and you'll be connected with some of the resources and action alerts that we send out. And then if you're so inclined, I encourage you to become a member. There are student rates and professional rates, and that's how the bills get paid around here at the WSPHA. And so we encourage you to sign up for the event and get on our list and engage. And thank you, Ashley. I see Ashley put the link in the chat box.
Yeah, so for those of you who are relatively new to Washington State, I have to say, as someone who came here just a couple of years ago, the annual Legislative Education Day is so much fun. WSPHA does such a great job organizing it. They have informational sessions to launch the morning so that everyone can, it's really good for our students, but for anyone who's like less involved in policy stuff, talking about a lot of the things that, that Jeff went through today, of like, what are the things that we're looking at? Why are they important to public health? What are our talking points? Just really great informational sessions, and then really sets up these meetings for students to meet with their representatives, which representatives like, because they get to meet students who are coming from all over the state. So of course, we're sad that it's not going to be in person this year, just because it's such a treat to go down to Olympia and just, see everyone in action. On the other hand, I agree with you. I think this is, an opportunity to try it a different way. And maybe I'm hoping we'll get more people involved. Our students often say it's hard for them to take the whole day off to go down to Olympia. And so we're hoping that this is an opportunity for more people to get involved. So I really encourage everyone to sign up for it.
And year to do it. In the past, you'd go down to Olympia, you'd start talking to a legislator about public health, and they'd say, oh yeah, but your local hospital. And now every legislator down there knows about public health, is concerned about public health. They're going to be receptive. So this is like going to be the grand positive experience of talking with our elected officials.
Every year I always say, this is the most monumentous year for public health in the legislature. But this really is that year. I swear. I mean, we are on there are two bills that would be, each one of them by themselves would be the biggest investment in the state's history into public health. And there's two of them. And the fact that they're being seriously considered, they're seriously alive. They're being a lot of behind the scenes sausage making going on, but I have never been this optimistic. Now, last year, there was a bill to tax the nonprofit carriers on their surplus to fund public health, and nonprofit carriers here in Washington have a surplus of about $4.5 billion, and this bill would have taxed them above a certain amount, 600% of what they need to have in the reserves, and above that, and it didn't even make it out of committee. It didn't even make it to either floor for a debate and a vote, because there wasn't that momentum to fund public health sustainably, predictably. And this year there is. And so as many voices as we can bring forward at this moment, for those of you who are students looking to graduate here in a year or two and looking for public health jobs, this is going to set it up very nicely. We're going to need lots of epidemiologists, lots of health educators, lots of public health nurses, et cetera, to fill these ranks to do the work. And because there's a lot of public health work that needs to get done in this state.
Okay, switching directions a little bit. So what do obviously people have been doing their best to keep up with the ever-changing dynamic of the pandemic. And I think the most common metaphor I've heard is this year is probably the building the plane as we fly it. And so not at all casting aspersions. I think we have an amazing group of public health leaders in our state, and we have been doing well as a state as a result of that. But that being said, looking forward, what are some top priorities in terms of things that we could do to further improve COVID response here in Washington state, including vaccine distribution?
The first thing that comes to mind is, there's been a lot of criticisms here in the state and nationally over how the vaccines have rolled out, and we point a lot of fingers in a lot of places. But those of us in public health absolutely saw this coming. So this is probably the biggest public health operation in my professional career, if not in country's history, to vaccinate this many people in rapid succession, and the fact that you have decimated your public health system and expected and worked it to death over the past year, and then expected it to spring up and deliver. What a surprise! And so this is sort of another punch to why we need to have a really strong public health system in this country and in this state, so that we can do things like this. Yeah.
So what I would say, I would point to two things that both are critical at this point, and I see some evidence that we're making progress. One is we just need to have more central coordination from the federal government and resource allocation. The vaccine, I mean, just we had, we saw this coming. We could have systems down better, and they're not. And I think a big reason is just that the federal government was not willing to play a central role, and it is more and more now, and that's a good thing. But the second thing, it really has to be happening at all levels, and we just have to do better at messaging. One of the, as we all know, public health is 99% based on trust public. When you have political leaders saying 100 different things 100 different times a day, undermining what we know to be good public health practice, you're really sort of, it's the petri dish of dysfunction. And now I think we've cleared the petri dish, and we can replant it with whatever we want. And I think we've got to really be thoughtful about how to message in a highly dynamic and changing environment. When the science is changing daily, we need to figure out how to give guidance, solid guidance and assurance to the public so that they can, so that they will behave in a way that has to blunt the pandemic, and that just hasn't been happening. So I'm really looking forward to much better messaging from the local level to the national level and everything in between.
Yeah, I couldn't agree more with both of those, Aaron. And I want to give a shout out. We had it's hard to keep track of who was the last person that we had, but it was either the last webinar that we had or the one before that. We had Michelle Andrasik here talking about how to center on communities. And she mentioned that the COVID-19 Prevention Network, CoVPN, which she has really been instrumental in making sure that communities are centered in their activities, that they were having train the trainer webinars, and also developing some really great materials that they've focus group tested for clarity in terms of messaging. And they're not just around vaccines, they're also around COVID more generally, but pretty highly focused on vaccines and answering a lot of sort of questions that people have. I will make an effort to put the link to, they have a YouTube video from the last session that they ran. I cannot recommend it highly enough. They just have really clean, crisp messaging that even for those of us who have been living and breathing COVID communication for the last year, it just was such a well done presentation, and their materials are really fantastic and freely available to anyone who wants to use them. So I'll put those in the chat box.
I think, my observation, over the last year, and maybe this is similar to both of yours, is public health, it's a noble profession for sure. But I think one of our faults is that we tend to be we tend to talk down to communities a bit. We tell them what they should do. We often don't tell them why. We often don't help them understand the rationale for the guidance that we give in a language that they can understand, that they can consume, and that they trust in. And we've got to get a lot better in interacting with. And I think Michelle, this is one thing that she talks about that I've heard her talk about is interacting with communities, hearing them, listening to them, and learning from them. So I totally agree that that's we've got to do more of that. Yeah,
couldn't agree more, Aaron. Yeah, and I would say, the other thing that I've noticed is, and again, I'm not criticizing our amazing public health practice partners who have done a fantastic job. This is just sort of like, lessons learned, that, one thing we know from risk communication is that it's really important to not just give people the one side of the communication, that you really need to explain both the pluses and minuses. And I think that's one lesson that, with COVID, looking back, that we could have, as a public health community, we all could have done a better job of, that might have not led to having mistrust later when situations changed. So
Yeah, I mean, one of the things that's key in it's I was formerly administrator for a couple of health districts here in Washington, and it was always key to make sure the health officer, and public health leadership and the board all got aligned as to what was the problem, what was happening, and what were the mitigations, what were the actions that are being taken, and why, and speaking with one voice to the media, to the public, etc. What I've seen in the pandemic is that one voice really fall apart in a lot of communities where the health officer or public health agency is saying one thing, and you have a member of your board of health saying something that's opposite, and really confusing people about where the truth lies, and then creating great conflict. And so I think that's really important. It's okay to debate behind closed doors and have those arguments and discussions and try to find compromise where compromise can exist. But to confuse communities over these multiple voices has been detrimental for sure.
okay, so next question. Aaron, what's the future of the ACA?
Well,
question.
Yeah, a little question. Well, I mean, I think the as a statute, as a construct that's embedded now in our healthcare system, it's going to continue. I think even before the election and before the inauguration, the smart people that I read, were guessing that the Texas lawsuit that's before the Supreme Court would not result in a repeal of the entire law. That decision hasn't come out yet, but in fact, Congress could make short work of that whole lawsuit by reestablishing fines for failure to get health insurance, which is the sort of core topic of that lawsuit. Anyways, I think it's going to. I think just as a construct, it will continue. I think, as I said before, one of the hopeful signs is that Biden and Harris seem to be intent on redressing one of the significant problems with the law, which is the health insurance exchanges. And even though there's a lot of subsidies flowing through those exchanges, still for low income and low middle income people, the health insurance itself is really expensive. And as I said before, the cost sharing provisions, the deductibles and co-insurance and co-payments make getting care out of reach for people who even have insurance. So more subsidies in the health insurance exchanges, I think, is something we'll see. And I think the other thing is that we'll see the administration try to find ways to allow states that didn't expand Medicaid under the Affordable Care Act to do so. Maybe dangling some additional financial incentives or other things, other incentives. But I think something like 2/3 of states expanded Medicaid, and the access to care in those states is substantially better than states that didn't expand Medicaid. So I think, we're likely to see that. I know that Biden talked about when he was campaigning, sort of in response to the Medicare for All proposal from the left, was suggestion that he would want to drop eligibility for Medicare down to age 60, which would be a substantial benefit because there's a fair number of people between 55 to 65, especially now in sort of the ever more tenuous employment market, who lack insurance and don't have the money or wherewithal to buy insurance on the individual market. So, dropping the eligibility to 60 years under Medicare would be I think a great benefit. I would just say that continuing to fill the holes of the Affordable Care Act is a good thing to do, but the basic structural weaknesses of the healthcare system are embedded in that act as they were before the act passed. The inability of the system to control healthcare spending is still going to be there. So even though I think we'll make progress in expanding the benefits of the Affordable Care Act, I think we're still going to be faced with those structural problems.
Jeff, you want to talk about the future of Healthier Washington?
Sure, great question. So back in 2013, when this proposal was introduced, I was president of the Washington State Association of Local Public Health Officials. And this was a big move. And for those who are not familiar with it, this was a move to, on a regional level, take Medicaid dollars and try to sort of front load improve the health of Medicaid recipients over the course of a 5-year grant. And it was a waiver that was granted by CMS, called 1115 waiver. And that 5 years is now coming to a close. And each region is going to, or accountable community of health, as they're called, is going to have to decide for themselves, is there value in what's in this operation, and figure it out how it's going to be paid for with the funding waiver ending. I haven't followed it as closely as this past year, but each accountable community of health has responded differently and done different things and built different relationships. And I'd say some did well and some less well. And so I think it's going to be interesting to see if this experiment continues or not. Ironically, the governor request bill regarding public health reorganization and regionalization had a little bit of that flavor to it. And so you think about regionalizing here in Washington State. I mean, Washington, even though we're a blue state, we sure act very libertarian-like when you look at how people vote on citizens initiatives, for example. And we're a home rule state where the counties are tremendously independent and fiercely independent and fiercely supportive of local control. And whenever we try to regionalize things, whether it's behavioral health, accountable communities of health, emergency management, Aaron probably remembers the old AIDS net back in the day. I'd say it's mixed results. And so, is this just a case of this very frontier state not wanting to play well in the sandbox with others? So I guess time will tell, and I'll be watching to see what the next step is for Healthier Washington, for sure.
So I have a couple of final announcements that I want to make, but I want to give you each a chance. If there's anything that you feel like we didn't cover, but you want to make sure that people hear, I'm turning it over to you. Aaron, you want to go first?
Sure. Actually, I just saw a note from my friend Mary Miller about this, and there's another, development in the legislature that I think people should pay attention to. It's something that's been on the agenda for many years. The state has a very, very regressive tax system. It's both regressive, that is unfair to lower income people, and it doesn't produce the revenue that we need to support the investments in our communities that would make this a much healthier place. So there are proposals. I don't have the bill numbers, and they'll be in fiscal bills a little later in the session. But there's there will be a proposal again this year to institute a capital gains tax. We're one of I think only 12 or 13 states that does not tax capital gains. Should. And there's other efforts around around tax credits for low-income people that we should be supporting, and closing some of the tax loopholes. If people want to know about that, they can go to the website of the Washington State Budget and Policy Center, budgetandpolicy.org. Full disclosure, I'm on the board, and they have great analyses, and they can give you information about the specific proposals. But those efforts are critical for public health.
Yeah, one thing that we're really focused on here at the Public Health Association is racism is a public health crisis. There's a couple of bills that we're watching very closely and are highly supportive of. One is 5044, which would provide greater training around racism and cultural competency in our K-12 system. And another one is 1264 and 5274, which would require the legislature to do equity impact statements on their bills, just like they're required to do so on economic impacts, fiscal impacts, some impacts on small businesses. But I think it's time we start applying these equity lenses to our policies and really make better decisions. So it's 5044, 5274, and 1264. Thanks.
And
thanks for having us here.
Yeah, Hilary, can I mention just one other thing?
Yeah.
I'll be quick.
Yeah.
And that is that the School of Public Health and the Department of Health Services are establishing a center on anti-racism and health.
I was just going to give an announcement.
Okay,
about that.
then please do.
Okay.
You should.
Okay, so yeah, I didn't pay these guys off, but yes, that was the announcement that I wanted to make, which was an update on our Arch director search. So Arch is the center that we have been striving to launch for the last couple of years on anti-racism and community health. And we are searching for a tenured full professor in Department of Health Services whose own work focuses on anti-racism, but also who could lead this very community facing center as well. So over the next couple of weeks, we are hosting candidates for virtual campus visits. This is what we do in the time of COVID, which include job talks and also smaller group meetings for SPH faculty and students. So please keep your eyes peeled for email announcements about those. Next week, we have Katie Kozamalno, who's a professor of the Division of Health Policy and Management at the University of Minnesota School of Public Health, and is currently the director of Rural Health Research, the Rural Health Research Center and Rural Health Program. She is giving a talk on Wednesday, February 17th, next Wednesday, at this same time slot, so 3:45 to 5 p.m. on racial justice and health, from research to reimagining the future. So please, like I said, keep your eyes peeled, sign up to meet with her. We're super excited about both her visit and then subsequent visits from a couple other candidates in the next couple of weeks as well. So super exciting. Other really exciting news is that our next webinar, which is on February 24th, our guest is going to be our new Washington State Secretary of Health, Umair Shah. So please mark your calendars. That's February 24th from whatever time it is that we do this, 3 to 4 p.m. And obviously we'll send out reminders about that as well. And Ashley's put Katie's talk information into the chat box. So one final note in our last minute, I just want to remind everybody about the virtual legislation education day, which is March 4th. So please register for that event, get involved. Like I said, it's a super fun event. Very, we all wish that we could go to Olympia, but the exciting news is more people can engage this year. So sign up, be present, and thank you so much, Jeff and Aaron. You guys are amazing. I feel much better prepared for not just legislative education day, but also just, ready to face the future and advocate for the things that are important to us in public health. So
Right on.
really
Thanks.
appreciate you guys, and also everyone who, put in great comments and engaged in the Q&A. Thank you so much, guys.
Thanks, Hilary.
Thank you for having me.
Thanks, Jeff.
Thanks, Aaron. Be well.
You too.
Bye.
Bye.